Well, I'd like to welcome everyone to the December coaching call. This is Dr. Edward Kondrot, and we have a very, very exciting topic that I think you're going to find extremely interesting. Vitamin C, the neglected hero in medicine, and also, are cataracts a form of focal scurvy? So, a couple of very interesting things, and I hope I'm coming through nice and clear. So if you can't hear me, you can go to the question area and just type me a comment that it's not coming through. This is going to be recorded, so if for some reason you have to leave early or you can't make this webinar, everything will be recorded and I'll be sending you a link. Also, I am going to open it up to questions, and even if you have a question during the webinar, type your question and I'll answer all questions at the end. Now, all this material was taken from a lecture by Dr. Thomas Levy, and this was given at the ACIM meeting in Orlando, Florida this past October. Dr. Thomas Levy is a brilliant cardiologist who has studied vitamin C and who has written several books on vitamin C. If you're interested in more information, this is a great book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable. It is very, very fascinating, and it has opened up my eyes, and I think his lecture in combination with his book is going to change the way that I approach disease and I treat eye problems. Now, it all begins with a person. I'd like to go into some history of the vitamin C. Frederick Klenner, and he practiced, he lived from 1907 to 1984, and he was the first doctor to fully realize that high-dose vitamin C could work miracles. And he published over 28 papers documenting his results. And he documented the ability of vitamin C to reliably cure many different acute infections and reliably neutralize any toxin treated when sufficiently given in the right dosage. And that's key, the right dosage. And I'll talk about that a little more. And this is some examples that vitamin C completely inactivated the polio virus. It was very effective for the herpes virus. So these are things that we think do not respond to conventional medical treatment, and even the treatments that do exist are very toxic, but this was demonstrated that they respond very well, that the vitamin C inactivates the poliovirus and the herpes virus. Resolved all acute viral syndromes, which it was adequately dosed. That's the key, adequate dose. Prominent example was vitamin C cured acute polio, 60 out of 60 cases. My goodness, and this was published in 1949. It also cured advanced polio and its associated flaccid paralysis. It resolved all acute viral syndromes for which it has been adequately dosed. And years after Klenner's experience with polio, it was demonstrated that polio responded very well to high-dose vitamin C given orally as well, with 5 patients receiving 50 to 80,000 milligrams given at various times over a 10-day treatment period. Another clinician showed a much lower doses of vitamin C clearly accelerated the resolution time of polio patients. including normalization of elevated temperature. So not only what was vitamin C found to be effective in treating and curing, it was also, when it was given in lower doses, it found to accelerate the resolution, lower the temperature, and reduce the symptoms. In addition, there were some publications looking at acute hepatitis. An author documented he never had a single case of acute viral hepatitis fail to respond properly to intravenous vitamin C. And he never had a vitamin C treated hepatitis patient subsequently develop chronic hepatitis. You know, we hear over and over again that there's no treatment for viral hepatitis, hepatitis C, but here in the medical literature in 1962 and 1981 and 83, evidence that vitamin C is very effective. And the question that I asked over and over again in my mind, why are we not hearing more about this? Why aren't more doctors using vitamin C? And the bottom line is vitamin C, there's no money to be made in vitamin C. Vitamin C is cheap, it's inexpensive, and Big Pharma cannot trademark vitamin C. They can't have these exorbitant markups. So let's go on. Here's some more. Vitamin C repeatedly cured cases of viral encephalitis, many presenting in coma. Holy smokes. Another article, treatment of poliomyelitis and other viral diseases with vitamin C. Different journals, massive doses of vitamin C and virus diseases. You can see the Southern Medicine Journal, and this is also the Journal of Applied Nutrition, use of vitamin C as an antibiotic. Resolved all acute viral syndromes for which it has been adequately dosed. Other examples, and once again, adequately dosed is key. Measles, mumps, herpes infections, influenza, swine flu, and this was reported in New Zealand. Rabies, vitamin C treated guinea pigs had improved survival. And this is documented of efficacy in non-viral infections. We're looking at diphtheria, tetanus, staphylococcus, streptococcus, pneumonias, all documented as curable with vitamin C therapy. While vitamin C is an absolute virucidal, it is often bactericidal. Now, virucidal means death. So they're making a statement that vitamin C will kill virus, and also it is bactericidal, often bactericidal, which means it kills bacteria. Then they make the comment, it's almost always bacteriostatic. Now, the difference between bacteriostatic and cidal, bacteriostatic means it'll prevent the growth of bacteria, which is important. If you have a fulminant infection, which is spreading all over the body, if you could just simply stop the bacteria from growing, could be life-saving. So it is always bacteriostatic. Now, the other point is that it is always strongly supportive of an optimally competent immune system. So it is supportive of our immune system. It doesn't work against our natural immune system. And properly dosed vitamin C will resolve all acute and many chronic viral infections, as well as most acute infections resulting from non-viral pathogens. And this is an example of malaria, positive responses, leprosy, typhoid fever, brucellosis, trichinosis, dysentery, trypanosomal infections, on and on and on. These are other non-viral infections which vitamin C has been documented to be effective. Now, this is something I have found to be very, very interesting. documented as the ultimate nonspecific antitoxin and poison antidote. So we're all concerned with mercury, lead, heavy metals. Toxic elements can be adequately treated like lead, mercury, chromium, these heavy metals with vitamin C. Snake venoms, snake and spider, observations of the dose and administration of ascorbic acid when employed beyond the range of vitamin in human pathology. High dose, daily dose of ascorbic acid can treat snake and spider venom. Also, alcoholic toxicity, alcoholic poisoning, barbiturate poisoning, vitamin C. There have been publications showing that high dose vitamin C can treat these conditions. Now, regardless of whether there exists an appropriate antibiotic or other antimicrobial agent for the administration, vitamin C should always be part of any protocol for any infection, acute or chronic. Now, what this is stating is that even if you're taking the appropriate antibiotic, vitamin C should be considered because vitamin C significantly enhances the immune function in at least 20 different ways, and Levy has published those in his book. Vitamin C has a direct anti-pathogen property, and we discussed that. It's virucidal. It is in some cases bactericidal and always bacteriostatic. Vitamin C neutralizes specific endotoxins and exotoxins, and these are the products that are secreted by the bacteria and virus that are poisonous to the body. And all infections consume vitamin C, so failing to supplement with vitamin C means the patient is will be dealing with an infection-induced pre-scurvy or even frank scurvy, making serial plasma vitamin C levels a routine part of all testing in hospitalized patients. So in other words, if the patient doesn't receive adequate amounts of vitamin C, because when you do have an infection, the body naturally utilizes its vitamin C to fight off the infection. So it's going to deplete its vitamin C reserves, and it will then lead, and this is really critical, this will lead to either pre-scurvy, frank scurvy, or focal scurvy. And scurvy is a condition that is well documented in the medical literature that's related to vitamin C deficiency. Although this is very uncommon, frank scurvy, simply because all you need is a small amount of vitamin C to prevent it. But scurvy essentially is a breakdown in the collagen. You have bleeding, weakness, fatigue, and it can lead to death. Also, vitamin C has been shown to neutralize radiation toxicity and repair damage from it. And in Japan, after the tsunami-induced nuclear plant breach, the Japanese College of Intravenous Therapy treated many individuals with vitamin C. In an unpublished study, they have shown that workers with heavy radiation-induced exposure receiving intravenous vitamin C only twice monthly, along with supplementation of oral liposomal encapsulated vitamin C, along some other ingredients, had a statistically significant drops were seen in laboratory tests for free DNA, which is a barometer or indicator of radiation toxicity. Now, I'm going to talk to you now about something that I think is really going to blow your mind. And when I was reading this stuff, I had an epiphany, and it kind of tied everything together that many alternative doctors are doing. So the question is, what do all toxins and infections have in common? Well, all infections and all toxins cause cell tissue damage and produce symptoms by increasing oxidative stress. no exceptions. So remember this idea of oxidative stress. So what happens when we have oxidative stress? Well, there's a depletion of electrons from the molecules that are oxidized. The more molecules there are that are oxidized, the more oxidative stress is present. So this represents not only a theory, but a highly efficient and accurate working model in clinical medicine. So if we look at redox biology, and this defines a property of a nutrient, is to metabolize into one or more substances that have the ability to donate electrons, reduction. So in other words, when we receive electrons in our body, that helps rebuild our tissues. It helps supply us with the energy to grow, to repair. So nutrients have the ability to donate electrons. Remember that. So an antioxidant is a nutrient, and a nutrient is an antioxidant. So even though there are a tremendous variety of molecular structures among all the known toxins, they all share the property of taking or causing to take electrons from molecules, oxidizing them. So remember that. If a molecule does not cause the loss of one or more electrons from another molecule, it is not toxic and cannot be toxic. So toxic substances in your body take electrons. They cause electron depletion or oxygenation. So I think you're beginning to see the picture now that electrons are good for you. The more electrons you have in your body, the healthier you're going to be. And you want to avoid substances that take electrons away, which oxidize your body. So electrons are the fuel for life. The combustion of this fuel is nothing more than the flow or exchange of electrons. So all increased oxidative stress causes electron depletion. All toxic effects are caused by increased oxidative stress. Increased oxidative stress is all of disease. So I think you can see the picture that vitamin C is a powerful antioxidant. It is a very powerful electron donor. It's donating electrons to the body. It's help repairing oxidative stress. Disease is oxidative stress. Disease is the loss of electrons. Now, a really fascinating book is Healing is Voltage. In order for the body to heal, you need an electrical current. If that electrical current is depleted, you're going to have a disease state. If it's depleted in an extreme fashion, you are going to get cancer. Now, we all been hearing about pH. You know, you want to have an alkaline pH, and acidic pH isn't good. So this was really interesting for me to read this. An acidic pH is an electron stealer. Remember we talked about electrons are good? You have an acidic pH, it's taking electrons from your body. The alkaline pH is an electron donor. It's giving electrons to where it's needed. So that's another reason why you need to eat a healthy organic raw diet, because a healthy organic raw diet has more electrons. When you're eating canned, preserved, or cooked food, they are electron deficient. So here's a table here that kind of illustrates. The first column is cell voltage. You can see that the more negative voltage, the healthier the cell, and also the more alkaline the cell is. So if you look at minus 50, that's a really high electron potential of the cell. It's alkaline, and this is where you can have regeneration. Minus 35 on the column there, 7.61, is normal for children. They have, growth period, so this is the minus 35. Then when you get to minus 15, minus 10, that is when you're tired and sick. 0 is a change in polarity. Then when the cell voltage turns to positive on loss of electrons, you begin to get acidic. So 7 is neutral, 6.9, 6.8 is acidic, and then finally when you get to plus 30, which is an extreme change in voltage, that's when cancer occurs. So you can see that this is kind of a little outline what happens to the cell. So certainly if you have macular degeneration, your cell voltage is probably going to be in the positive range. It's tired, it's sick, it's not working. We want to change that cell voltage. We want to add electrons to change the pH so the cell voltage can become more full of electrons so the body can heal. Now here's some common ways that electrons are taken from your body. Acidic water, tap water, chlorinated water, fluoride, most bottled water. Carbonated beverages also take electrons from your body. Caffeinated beverages, alcoholic beverages, cooked food, processed foods. And here's something interesting. Moving air takes away electrons. Wind, air conditioning, fans, convertibles, hair dryers. I didn't know that, but studies have been done to show that. Now, how can we put electrons back into your body? Well, there is an exchange of electrons between people. So when a healer, a doctor, touches you in a healing manner, you're receiving electrons from that doctor or healer. The danger is that if the doctor or healer isn't healthy, they're going to become depleted and they're going to get a disease state. And this is one of the reasons why what I have observed is there seems to be a high incidence of cancer and cardiovascular disease in doctors that are overworked because they're donating electrons to their patients and they're not taking care of themselves. Of course, a good hug, you're exchanging electrons. So if you hug somebody that has more electrons than you, you're going to be receiving those electrons. Parents holding a sick child. Moving water. Not still water, moving water. So when you're taking a shower, you're receiving electrons. It has to be running water. Still water doesn't make it. So if you're in a hot tub, you have to have the jets on to move the water. Also grounding to the earth. I talked about this other times, the importance of taking off your shoes and socks and being grounded to the earth. But there are two other ways that you can receive electrons. And some of you, it may already have popped into your mind. But microcurrent, my goodness, microcurrent is a device that is generating electrons and putting electrons into your body. So it really makes sense to me that microcurrent is an electron producing device that's putting electrons into your body. And also ozone or oxidative therapies. Ozone is a highly reactive form of oxygen that has a negative charge, and it is giving your body electrons. Now let's talk about this idea about successive vitamin C treatments. And now vitamin C is an antioxidant. It is an electron donor. Almost all clinical failures of vitamin C administration are due to inadequate C delivery to the target tissue. While a lower dose may still be beneficial, a 30-gram IV infusion may result in little discernible clinical difference, while 50 to 100 gram or 150 gram could make a demonstrable, progressively more positive response. So this is the problem. You need to get a high dose of vitamin C into your body. You need to get a high dose of vitamin C in your body. And probably the only way to do this is intravenous. So the intravenous form is the most desirable. But the other interesting thing that I discovered is intramuscular can be very effective as well. So many of you who maybe have poor veins, you can't receive the IV, you can receive intramuscular. So let's talk a little bit about this intramuscular form. So in small patients where veins are at a premium, ascorbic acid can be given intramuscularly in amounts up to 2 grams at one site. Several areas can be used with each dose given. Ice held to the gluteal muscles. And ascorbic acid can be given by mouth as an ancillary treatment. And Dr. Klenner felt that every emergency room should be stocked with vitamin C, to help. And of course, I don't know any emergency rooms that even consider vitamin C as a treatment. Now, let's look at liposomal vitamin C. This has been a really big advance that liposomal vitamin C is a specially formulated vitamin C that has a more rapid and a very enhanced absorption. There's no stomach upset or no ascorbic induced diarrhea and has a much better bioavailability. The problem with oral vitamin C, the non-liposomal vitamin C, you can only take up to maybe 3 to 4 grams. What happens if you go higher, you'll get loose stools, you'll get diarrhea, you'll have problems. So most people can only tolerate 3 to 5 grams of vitamin C. And according to most of the studies, in order for vitamin C to be effective in treating disease, you need to go up to 25, 50 grams, even 100 grams. And this is just a comment that unless another therapy is inherently pro-oxidant and toxic, vitamin C will only augment the desired effect. And even with highly toxic agents, proper vitamin C administration can help reduce the desired outcome. So what I'm referring to is chemotherapy. Vitamin C will neutralize chemotherapy if taken simultaneously. And many doctors who are administering IV therapy recommend that IV therapy in treating cancer is done not when the chemotherapy is administered. So not only will the vitamin C work well in correcting the damage done by the chemotherapy, it will also help protect normal cells if it is given before chemotherapy. One of the problems is that during the intravenous vitamin C or highly dosed oral vitamin C, a Herxheimer-like reaction is often caused. This is often due to an accelerated release of stored intracellular toxins. It can also be secondary to a massive kill-off of pathogens. So you have to be careful when you're receiving vitamin C, intravenous vitamin C or high oral. It may cause flu or a sickness, and this is due to a kill-off or a release of the toxin. So this has to be monitored. So if you begin to receive a high dose of vitamin C and you are getting some toxic reaction, then maybe skip a day of the vitamin C or go to a lower dose. Now, for optimum vitamin C treatment of chronic disease, toxin sources need to be addressed. And one of the most common sources is dental infections. And of course, many alternative doctors feel very strongly you have to treat root canals, you have to treat periodontal disease, and you got to treat problems with infected implants. In other words, these focal areas of infection are going to prevent the adequate response to the vitamin C. Now, the last thing I want to talk about is that cataracts may be a focal form of scurvy. And this to me was really, really interesting because focal scurvy has been described, and periodontal disease is considered focal scurvy, arteriosclerosis, of course, gum bleeding, periodontal disease, etc. They're all forms of focal scurvy. But I never heard of this idea that cataracts might be a form of focal scurvy. But it kind of made sense to me because, number one, in medical school I studied that low levels of ascorbic acid or vitamin C are found in the aqueous humor of patients with cataracts. So there is a kind of loss of vitamin C when you do get a cataract. Dr. Rowen formulated an eye drop that contains ascorbic acid and has been shown to reduce cataracts. So if this is the case, then maybe high doses of vitamin C might reverse cataracts. So what I'm suggesting is that people with cataracts consider a course of IV vitamin C or high-dose liposomal vitamin C. Now, vitamin C is now a part of the Kondrot program. We are now giving all patients that come to the center high doses of intravenous vitamin C. And they're getting 25 to 50 grams daily. I'm also recruiting patients that have cataracts that might be interested in receiving high-dose vitamin C to see if it helps resolve the cataracts. So you have an opportunity to spend 5 days in the warm Florida sunshine and at the same time receive 5 treatments of intravenous vitamin C. Now, this idea of making your own liposomal, unfortunately, liposomal vitamin C is much more expensive than regular vitamin C. The liposomal vitamin C will probably cost in the neighborhood of $1 a gram compared to powdered vitamin C, which is mainly a nickel a gram. So I came across a recipe that you can make your own liposomal vitamin C. The liposomal vitamin C is 6 to 8 times more powerful than oral, and Dr. Levy feels that the liposomal vitamin C might be just as effective as the intravenous. So what I'm recommending is that patients do receive the intravenous vitamin C, and at the same time, either continue with the liposomal to make sure they have adequate dosing. Because remember, all the failures of vitamin C treatment were due to lack of dosage. So here's a way you can make your own liposomal vitamin C. Get 1 cup of warm water, dissolve 2 tablespoons of vitamin C crystals. You get 2 cups of warm water and you dissolve 6.5 tablespoons of non-GMO lecithin. And both the vitamin C crystals and lecithin are very inexpensive. So you mix and blend these for several seconds in a blender. Then you place them in an ultrasonic jewelry cleaner for 8 minutes and mix. And this mixture is about 70% capsulated efficiency, which is not bad. And it will only last a couple of days, so you have to make the batch fresh every couple of days. But this is a way that you can begin taking higher doses of vitamin C, up to 10 grams a day without the gastrointestinal problem. So there's also a YouTube video on how to make it. So I'm encouraging all of you with cataracts and macular degeneration, begin to take high doses of vitamin C. Also, it's been shown that high doses of vitamin C can lower the intraocular pressure in glaucoma. So this may be a mechanism, taking the liposomal vitamin C, controlling your intraocular pressure. So this is a lot of exciting things here, and I'm hoping that you folks who begin using this will give me some feedback. Now, you know we have a lot of goats at the center, and this is something interesting about goats. Humans cannot make vitamin C. We are probably the only mammal that can't make vitamin C. But goats make their own vitamin C. In fact, the average adult goat weighing 70 kilograms will manufacture 13 grams of vitamin C a day, and many times higher when in stress. So the goats on our ranch are vitamin C producers. I like this quote by Mark Twain. Be careful in reading health books. You may die of a misprint. But when it comes to this book, I don't think you're going to die of a misprint. This is a phenomenal book, Curing the Incurable, Vitamin C, Infectious Diseases and Toxins. And I would highly encourage you to get a copy of this book to learn more. So that is the end of the webinar. And I have recorded this, and I'll be sending it to all of you, and also a copy of the slides and the link. So if you do have any questions, I'm going to be opening up the lines for questions. And there's two ways of doing this. One is that you can just type me a question, or you can click the hand button to raise your hand and you can talk to me. So right now I don't see any hands raised and I don't see any questions. So I'm going to wait a couple of minutes. So type your question for me, or if you wanted to ask a question, and I see a hand up. So Susan, you're unmuted. Can you hear me? Susan? Okay, I guess Susan can't hear me, or I'm not hearing you, Susan. I've unmuted you, but I'm not hearing anything. So maybe you could write your question that you have, or maybe you inadvertently raised your hand. Okay, there's a question. Would it be beneficial to do glutathione intravenously? And yes, glutathione is a very powerful antioxidant. The problem with glutathione, it is unstable. It's not as stable as vitamin C. And in fact, I talked to some pharmacists. You know, Dr. Rowen's eye drop has vitamin C, glutathione, and DMSO. And there have been studies done to show that the glutathione doesn't last very long. So, number one, glutathione is more expensive than vitamin C, and there's no demonstration that glutathione is more effective. So, I think that the vitamin C, intravenous vitamin C, will be more effective for the treatment of cataracts. Another question, recommendations for avoiding GMOs. Certainly, genetically modified food they are electron stealers. They do not donate electrons to your body. Cooked food, preserved food, heated food, processed food has negative energy. It's taking electrons from your body. When you're eating live, raw, healthy, organic food without preservatives, they are electron donors. They're giving electrons to your body, and that's what you want. And let's see, Susan's hand is up again. Susan, do you hear me? I guess not.
Yeah, can you hear me this time?
Yeah, I hear you now. So fire away with your question.
Okay, so you're hearing me?
Yep, I hear you fine.
Okay, you had recently had something on arnica, improving blood flow, and I'm just wondering if that would help with glaucoma.
Not really. It was mainly for the treatment of diabetes, because in the diabetes, you get tiny little blood vessels in the back of your eye,
Mm-hmm.
bleeding blood vessels. So the low dosage of arnica was primarily for diabetic retinopathy. So it wasn't really for improving the blood flow. It was for resolving these hemorrhages and taking care of the bleeding, which then interfered
Okay.
with the blood flow. So I would
Okay,
not
that's fine.
recommend it for glaucoma.
Okay, thank you.
But I do think if your eye pressures are not under good control, this idea of taking liposomal vitamin C as a daily supplement might be the answer. Because I've had many glaucoma patients take um, oral vitamin C, not the liposomal. They would take 3 to 5 grams a day, and they began having loose stools. It was toxic, and it just wasn't a dosage high enough to lower the intraocular pressure. But if I think you're taking 10 grams of liposomal, it can be very uh, uh, not. It could be non-toxic to your body, not cause any gastrointestinal problems, and it might be the trick to lower the pressure. And at the same time, you know, contributing more electrons to your body, along with the microcurrent and the ozone.
Okay.
Okay, thanks. All right, we got some more questions. Do I sell the liposomal? I think we do have some liposomal because we do handle some of Dr. Rowen's products. You could call the office, and I have been looking at some companies that manufacture liposomal to try to get the best price. I know that I've ordered some online myself, and most of the liposomal products are fairly expensive. If you are interested, it's very simple to make your own liposomal, and I'll be sending you a link on how to make your own liposomal. But give the office a call regarding. Oh, here's a good question. Does goat cheese have vitamin C? That's a really good question, which I don't have the answer. I think there's probably some vitamin C in the goat cheese. But remember, the vitamin C is being utilized by the goat. But I do think if in times of stress and also the milk is transferred, so that would be something that I'm going to have to research. It could be that goat cheese does have the vitamin C, but unfortunately, when you're heating the milk and processing it, a good part of that vitamin C might be lost. I am recommending, the question is in terms of the dosage of vitamin C, I would recommend you start out with 25 grams of vitamin C intravenously and then work up to 50 grams. And right now, I'm going to be looking if any of you have cataracts and you are interested in coming to Florida for 5 days. We're going to be looking at the dosage. So I would start with 25 grams of intravenous vitamin C, then work your way up to 50. Of course, you can go up to 100 grams, but I think that most of the effectiveness will be accomplished using 25 to 50 grams of vitamin C. But also remember, you need to eliminate focal areas of toxins in your body, such as dental caries, root canals, and things like that. And could you tell us how much the cataract study of 5 days of vitamin C will cost? Well, because of this is a study, we're going to offer a discount. So I would give uh, the wellness center a call. Certainly, the treatments are not going to be more than $100 a day. Giving the IV vitamin C 25 to 50 grams a day. We'll also be showing you how to make your own liposomal vitamin C during those 5 days. And then what we'll be doing is we'll be accurately recording the density of your cataract, the vision, the contrast, and see what happens over time. So there'll be no charge for the evaluation, the documentation of your vision, but we do want to see if this is effective. So if you are interested, come on down, especially those of you that live in the Northeast when the snow comes. Hey, we're open for business. It's nice and warm for Florida, and would love to have you. So I think all this is very, very exciting, and I would like you to begin taking more vitamin C and investigate in the liposomal vitamin C. For those of you that are coming, maybe returning to the center in 6 months for your visit, maybe plan on spending a couple extra days to get some vitamin C treatments. So the question is here that I'm taking nutraceutical vitamin C powder, 4 grams per scoop, 11 grams per day. Vitamin C kills cancer cells. So you're right, vitamin C does kill cancer cells. But this nutraceutical product, I don't think it's a liposomal product. So I think you're going to get much more result by taking a liposomal form of vitamin C, because 11 grams of vitamin C per day isn't really a therapeutic dose unless it's a liposomal product. So, Dottie, you commented on this American nutraceutical product. Is it a liposomal product? Or is it just a straight vitamin C powder? And you may want to take that powder, if you're taking a vitamin C powder, and convert it to a liposomal. See, the liposomal vitamin C is a liquid. It's not a powder because it's encapsulated with lecithin to make it fat soluble, to make it more readily absorbed into the body, and it's not destroyed by the stomach acids. So a lot of good questions that you folks have, and please fire me some more questions. This is a really exciting topic, and if you're not sure about something, now's the time to ask me. And as I mentioned, this is going to be part of our program now. We're going to be giving a lot more intravenous vitamin C. It's interesting that the Mars cocktail, we have about 10 grams of vitamin C in the Mars cocktail. And I just don't think that that's adequate. I mean, it's powerful as an antioxidant. It's powerful to help healing, but in terms of the therapeutic effect, because remember, all the research that Dr. Klenner and Dr. Levy has studied, vitamin C failures are due to inadequate dosages. So you need to get the proper dose. And a vitamin C IV is extremely safe. It's not painful. It's non-toxic, and it seems to be well tolerated by people. It's probably one of the easiest vitamin Cs to do. And the other option is if you're not able to get the intravenous, then we can do the intramuscular vitamin C. Another question here is, can we do micro treatments every day? I've been doing 6 of the programs every day. Yes, you can do microcurrent treatments every day, because remember, the microcurrent is an electron donor. It's putting electrons into your body. Your body needs electrons for healing. But you can do you can't overdo the microcurrent treatment for your eye. I only recommend 1 eye treatment a day. Don't do more than 1 a day. But in terms of your body programs, the stress and detox, you can do those more frequently. There was another question that somebody asked me, the best time to do the microcurrent and the best time to do the light treatment, and can you do them right after one another? I prefer that you do the microcurrent treatment for your eye at night before you go to bed because the eye is regenerating at night and it makes sense to do it right before you go to bed. Although I don't have any data to show that it's more effective to be done at night. There is data to suggest that you should do the light therapy during the day. Do not do the light therapy at night, because if you do the light therapy at night, it could interfere with your circadian rhythm. And yes, you can do the microcurrent after the light or before the light. You can do them right after one another. They don't have to be separated by any time period. The question is, I've been foregoing microcurrent treatment 1 time a week, usually after acupuncture. It depends what type of acupuncture you're doing and where. If you're getting acupuncture on a Chinese meridian away from the eye, then I think you could probably do the microcurrent along with that. But if you're actually getting the microcurrent to the eye with needles around the eye, then you may want to stop the microcurrent and not do the microcurrent that day or the day after. But I like acupuncture. Acupuncture can be very effective in stimulating healing, stimulating the eyes, and balancing the acupuncture meridians. Remember, acupuncture is putting electrons into the body. When those needles are inserted, they're kind of like a conduit of taking electrons from the atmosphere, the air, or the practitioner, the acupuncture practitioner, and putting it back into your body. Any other questions? And you can either type a question. Let's see. I see a hand up. Dottie, did you have another question?
I'm working on it.
Okay. Oh, did you check and see that
Can you hear me?
the
Can you hear me?
American nutraceutical vitamin C powder, that's not a liposomal powder, is it?
Can you hear me
I hear you fine.
right now? Oh, okay. Um, the description of it that I have is it's a ribose, um, and then it also says it has a base of beet source ribosomal RNA with ribose nucleotides, including D-ribose malate. It actually is part of my anti or after cancer regime
Hmm.
that
Well,
that
see,
Dr. Keeley has me on.
that's not a liposomal product. And you may want to talk to Dr. Keneally about
Okay.
putting you on a liposomal because you get much better absorption and you get a much better effect. Because right now, 11 grams of oral is not giving you a therapeutic effect, according to Dr. Levy and Dr. Klenner.
Okay, but it's also supplemented with IVs also. I
Well,
mean,
that's different. Yeah, when
when I
you're
was in
getting,
Germany, I had tons of IVs of vitamin C.
yeah, but I'm looking for something that benefits you right now on a daily basis because,
Right,
most people can't get daily IVs at home, but you
right.
can take 10 grams of liposomal vitamin C every day.
Okay.
Every day. Now, the
The other
other
thing
thing is
too.
make sure that your vitamin C is not corn based. You want to
It's
make
not.
sure it's
No,
non
because
GMO. You want to get organic, non GMO vitamin C. The other scary thing is, I read an article that 70% of all our vitamin C comes from China. So you really want to get a reputable company and a reputable product and make sure it's not from China.
okay, the company, this American Nutraceuticals, they're actually based in Florida, and his whole product line are cancer treating drugs. I mean, cancer treating supplements, I should
Hmm.
say.
Well,
So,
I'm sure that they're probably non GMO because
oh, absolutely.
GMO can cause cancer. So,
Oh no, they're absolutely, because the guy that owns the company is a 40-year cancer survivor.
mm,
So
good.
it's all of his products are very, they're from they're Chinese-based, what should I say, ingredients, but no, they're not GMO.
Mhm.
Definitely not.
Okay, good. We have
Can I ask
another.
one other question?
Oh yeah, sure. While your
Okay,
hands up, you're standing in the
I'm
classroom.
coming. Okay, um, I'm coming to that ozone seminar on Friday,
Oh,
and
wonderful.
I'm assuming we don't need the ozone machine or anything. They're just going to talk from there.
We're going to have an ozone machine there at the seminar. We're going to
Okay,
be doing demonstrations, but
and
we
the
will.
demonstration I'm hoping I'll get to see because I'm leaving the hotel at 1:30. The only flight I could get out was 3:30.
Hmm.
So hopefully I'll see the demo.
If not, the next time you come back to the center, you
Okay,
know, we'll give you a demo at the Florida Center.
okay.
All right.
But I want to be using it before then. That's what I'm hoping.
Mm-hmm. Well, you may want to bring your machine with you. Oh, you know what? We'll have a machine there. Don't worry. We'll take care of it for you.
Okay, okay.
All right.
That sounds good. Thank you.
Okay. Okay. Another question. Is it unusual to be on your cataract treatment program for more than 3 years? I have noticed some improvement. Well, you know, the cataract program is kind of anti aging. As we um, get older, we are going to have aging changes in our body, and cataracts are just part of that. So you have to be on a program for the rest of your life. But I'm happy to hear that you have noticed some improvement, and I'm assuming it's improvement of your vision. But I'd like to hear you say, I've had a great improvement. And maybe by adding the vitamin C, the high dose intravenous vitamin C, or taking the high dose liposomal vitamin C, that could make the difference. If indeed cataracts are a form of focal scurvy. And you also need to get your heavy metals tested, get rid of them in any part of your body that has a focal infection, in particular your mouth, such as a dental carie, a root canal, periodontal disease. You got to get that checked. All right. Any other questions? You can raise your hand. Um, let's see. I don't see any hands up. If you want to talk to me and ask a question, raise your hand. So anyway, this is the last webinar of 2013. I'm looking forward to continuing these webinars in 2014. That's uh, part of being part of the program. These coaching calls are really important, especially for you to ask me questions. And now we have a bunch of questions here. Okay, the question is, can I use my small ozonating machine that I have been using, the saline drops, to make liposomal? The ozonator does not make the liposomal. It's an ultrasonic cleaner. Ultrasonic cleaner. You've seen those jewelry cleaners that vibrate. You plug them in. They cost about $20. You put your jewelry in, water, and it vibrates. That's the ultrasonic cleaner. So you don't make the liposomal with your oxygen ozonator. You make it with a jewelry cleaner. There is a YouTube video that shows you exactly how to do that. How does one check for focal infections? Well, you can get a thermogram of your mouth, and the best way is to go to an integrative dentist to be evaluated with dental x rays, because sometimes you can have a cavity of an infection in the bone by one of your teeth, and you have no symptoms. So it needs to be evaluated by an integrative dentist. And most of the focal infections are inside your mouth. Um, Susan, did you have a question?
Yes, can you hear me?
Yep, I hear you fine.
Okay. You had said earlier to only use the microcurrent on the eye once a day. Now, a while ago, you had shortened my program and told me to do it twice a day. But that really has never worked for me, so I'd be better off to go back to the once a day.
Yeah, well, some people that have glaucoma or they can't tolerate the longer program, we do have 2 shorter programs. So generally speaking, I only want you to do 1 program a day on your eye. So I was speaking in a general term, but some people I do have it on twice a day.
Okay, because it's going to be a lot better for me to do it once a day.
Then you would have to email me or email the office so we can change your
Okay.
machine. And then you can either mail it in or the next time you visit, we can get it back to, the time.
Okay.
Time
Okay. After taking the class, I may be able to do it myself.
Mm-hmm. Yeah, you should be able to give it a shot. See
Yeah.
if you can do it.
Right.
Okay.
Okay. That answers the question.
Okay. Okay. Any other questions? I don't see any other hands, and there's no other. I'll wait a couple of minutes. But as I was saying, that I've enjoyed these coaching webinars, and I hope we have a dynamite lineup for 2014. It'll be the first Monday in January, and I do like your feedback. So, what topics you are interested in, questions you have, and I think Dottie, do you have a question? Dottie, do you have a question? I saw your
Am I
hand.
unmuted? Oh, yeah, yeah. Real quick, she just reminded me something when the program to learn how to program the microcurrent machine.
Yes.
When will you be having another one of those? And do I have to come to Florida to do that, or?
Well, we're planning to have them in Phoenix and in Florida, 2
Well,
locations.
Phoenix would be better. Would be closer.
Okay,
Yeah.
because now that I'm the clinic director of the American Medical College of Homeopathy, which I'm very proud of, we plan to be having some training sessions in Phoenix. So you might want to check
Okay.
with the office. I know we have a training session in March, but it depends on interest. I'm flying out to
Okay.
Phoenix every month. The first week of every month, I'm going there. So
Okay.
we could coordinate it that weekend, a training program, because I really think I want you to be able, all of you that are using the microcurrent, to be able to program your own machine, be able to use microcurrent to its full capacity, because it's not just for the eye. It can be a wonderful treatment modality for so many aspects of your health, and that's going to be part of the training program.
That's why I was really interested when I saw that two sheet long of all the things it could do.
Mm-hmm.
It would be nice to be able to maybe shift them around and that kind of thing.
Yeah,
So
that's the purpose of the course.
okay.
And we have another question. Is there an archive of all of the webinars? Well, Leslie, you just gave me another project. So what I'm going to do is I'm going to come up with a website you can go to with all the archives of all the programs of 2013. So I'll be sending that to all of you so you can go back and listen to those programs. So there'll be a link for each of the monthly webinars. So I'll put that together for you, and I'll be sending you the video and everything for this is being recorded, so I'll be sending you the video and a copy of all the slides. Okay, well, I want to thank everybody for participating, and if I don't talk to you again, have a wonderful holiday season, and I look forward to our next webinar, which will be January 2014. So thanks, everyone.